Stay in touch with your community connection.
Good afternoon, everyone. Welcome to Your Community Connection. I'm Sarah Sager, and joining me today is Bradley Barnett. He is the operations manager at OVP Health, and we are so excited you're here, Bradley. Thank you. I know you manage the offices in Logan, Williamson, and Pikeville, correct?
I do.
Wonderful. Well, thank you for being here today. We appreciate it. All right, so Bradley is here to discuss medication-assisted treatment and counseling for substance use disorders. For those who aren't familiar with medication-assisted treatment, do you care to explain what that means?
Substance use disorders are a very complex problem. Medication-assisted treatment, as the name implies, is the use of medication for clinical stability, while the treatment is implemented via psychosocial interventions.
Okay. And I know this is medication-assisted treatment. Sometimes they call it MAT, correct?
Yes.
It's considered to be like the gold standard in treating substance abuse disorders, which I know we have our fair share of in our area. So why is it considered to be such a highly qualified thing to use, or the gold standard?
There is a substantial body of research that proves the effectiveness of MAT services. It's not debatable that it improves outcomes, it saves lives, and people get better with this treatment.
Yeah, so, but if you are hearing an argument against medication-assisted treatment, it's that you're just trading one drug for another. But isn't your goal to eventually wean your clients off of Suboxone entirely?
It can be. Back in the earlier days, there was an accepted truth that you should only be on a certain medication for a limited amount of time. But what we found over time is that it's individual. It's an individualized basis. Someone may need to be on a maintenance therapy for the rest of their life. Someone may want to taper off eventually.
It just depends on your client.
It's an individualized treatment.
Okay. And when listening to people talk about substance use disorders, we often hear the term addiction and dependence. Do those terms mean the same thing?
Those terms are used interchangeably, but they're not the same thing. As a clinician in the field, I'm not interested very much in dependence. A person can be dependent and fully stable and functioning. They can work a full-time job, they can take care of their family. We're more interested in addiction as the behavioral dysfunction that often goes hand in hand with illicit substance use. So the lying, the cheating, the stealing, the unhealthy social environment, those are the aspects that we're looking at identifying and removing in treatment. Okay.
That's good to have that qualification and understand those words better as we use them. Now, OVP Health has been helping people with medication-assisted treatment now for over a decade, but we've seen a lot of new MAT businesses pop over the last couple of years. Do you care to tell us what makes OVP Health different from some of those other newer treatment providers that we've seen?
Yeah, the first thing that separates OVP Health from all the other providers is first our staff. Our clinical staff, our support staff, they're genuinely invested, they genuinely care about the well-being of our patients. But objectively speaking, unfortunately there's a lot of bad actors in the field that operate in blatant disregard of all regulation. OVP Health is not one of those. We go to great lengths and tremendous expense to follow all federal guidelines and state regulations.
Now, if someone is watching this right now and thinking, I have a loved one that may benefit from the treatments, or maybe myself, maybe I need to seek out some help, how would you suggest that they go about getting in touch with you or one of your clinics?
Just access our website. All of our locations are listed there. Just call our offices. We provide primary care treatment, regular behavioral health outside of the MAT realm. Just contact the location closest to them.
Okay. And I know you're in the Logan, the Pikeville areas, and so I know some of these places have been, hit hard by job loss, especially during this past year. It's been tough. So it's great that you're also a provider of some of these other services, so that if you need multiple services, just reach out. Anything else you would say to our viewers before we let you go, Bradley?
I'm here to help reduce the stigma around substance abuse treatment. It's not helpful to the problem, and it's killing people.
And I think that was so good that you reached out and said, okay, here's the difference between addiction and dependence.
Yes,
so thank you for that clarification.
Very
We appreciate it. Bradley, thank you for being here today, and thank you all for tuning in to your Community Connection.